Dialogue with a Doctor, featuring one of Southwest Florida's leading gastroenterologists, Dr. Raymond Phillips of Gastroenterology Group of Naples.
Welcome to our show today. Well, Dr. Phillips, thank you for coming on. And if people haven't seen our show before, just tell us a little bit about yourself.
Yeah, absolutely. I'm a gastroenterologist. I'm trained in digestive disease and liver diseases. And what that represents, I went to college. I went to college at Princeton. I went to medical school in St. Louis, Washington University, and did my internal medicine training at Jefferson Hospital as chief resident there. And because I'd gone through Princeton on ROTC scholarship, I went on active duty at that point, and I was an internist for 2 years at Fort Leonard Wood, Missouri. And then I was selected for gastroenterology training at Walter Reed. And then after my training was complete, I was on staff at Walter Reed, where I did research and saw patients. And in the 1990s, I got out of the Army, came down to Naples, and our practice has gradually grown over the years. I have other gastroenterologists I work with, my partners, Dr. Gustavo Rivera, Rafael Urbina, Sandra Hara, Susan Libersky, and we all have offices in Colonial Square in downtown Naples and Marco Island and Bonita. The point of all that, just to understand, that I'm an expert in digestive diseases, and which involves any kind of ailment from the mouth all the way to the other end, as well as the liver and the pancreas, gallbladder, etc.
Well, Dr. Phillips, somebody wrote into our show, okay, and they have a question for you. They're having diarrhea 3 or 4 times a day. They have some weight loss, and they have loss of appetite. What's causing this problem, they're asking us?
Well, yeah, diarrhea, there's lots and lots of different causes for that. And oftentimes we have to sort of go through a careful history in terms of identifying things, in terms of travel, exposure to medications and other things to help guide us. An area for most Americans in the United States who are not traveling overseas or eating different diets, it's rare to get more than 1.5 episodes of diarrhea per year. That's what the CDC has most recently reported. One of the most recent concerns, though, is that rising incidence of a particular kind of infection called Clostridia difficile that can lead to a diarrheal illness that can be persistent and not resolve. And it can sometimes emerge a month or 2 after taking antibiotics. And it can initially be mild in its nature, but then can accelerate to a more moderate to severe illness. And many people will get such an intense infection with this, they can actually require hospitalization.
That's right.
So it can be pretty severe. And it's actually an epidemic across the United States. It's a leading cause of infections associated with bacterial infections associated with diarrhea. And it has a high death rate. There's about 300,000 cases per year of Clostridia difficile, often abbreviated C. diff, just because it's kind of a mouthful to say Clostridia difficile repeatedly. But it's referred to as C. diff, and there are antibiotics that are effective for treating it, but it can sometimes be problematic because the infection it can come back again even after a course of therapy.
And I think you've said on previous shows you should minimize the amount of antibiotics you take, or not?
Well, absolutely, absolutely. And this infection was just first, it was rarity across the United States until about 15 years after the introduction of antibiotics across the United States. It became to be recognized more and more frequently. Initially, it was only associated with certain antibiotics, and now it can occur with any antibiotics. And what's particularly apparent is the longer and the course of antibiotics, the more repeated the courses of the antibiotics, the more and more likely an individual is to get this infection. And the reason is it used to be exclusively associated with being in the hospital. Because this particular germ, this particular organism, it releases spores, and an individual who's hospitalized with this can sometimes release a number of spores that are very, very difficult to eliminate from the environment. And as well, it can lead to a circumstance where even healthy individuals can be colonized with this particular germ. So, and healthcare providers can sometimes carry this particular germ, although not be ill, and be able to pass it on to patients. And so an individual who is in the hospital receiving antibiotics, their defenses are diminished, their immune systems are diminished, but more to the point, the microbiome, the bacteria within their colon that helps protect them, it will be diminished as a consequence of the antibiotics and make them more susceptible for this germ emerging and causing infection in that person who has received antibiotics. So it's a combination of events: exposure to antibiotics, exposure to this particular germ, C. diff, and that combination of events can lead to infection. Formerly it occurred more commonly in a hospital setting, but now it's occurring more commonly in an outpatient setting in individuals who are not necessarily hospitalized.
How about children that get a lot of antibiotics? Does this affect them too?
It can affect children. It can affect children. Children are a little more resistant to this than adults, so it's less of an issue. And children will oftentimes, they'll have more specific reasons for using antibiotics. That is to say, the pediatrician is pretty selective about using antibiotics for clear-cut cases of otitis. But many adults seek antibiotics for, the truth be told, viral infections. They get a stuffy nose from a viral infection, believe they have a sinus infection, a bacterial infection, and seek out antibiotics. And a well-meaning doctor may provide them the antibiotics. And in that context, if it's a viral infection, they're not going to get any benefit from an antibiotic, but they certainly get all the potential adverse effects of the antibiotic. And there has been a great proliferation of use of antibiotics these last 20 years. And as a consequence, this epidemic of C. diff has become more and more of a health issue across the United States.
Yeah, because even on pharmacies, you can get antibiotics. They're not expensive, or they're some cases free, or they're $2 or $5.
They're very inexpensive. They don't. They still require a prescription.
Right, they do. Right.
Yeah, they still require a prescription. But the difficulty is that if you insist on receiving an antibiotic and you press your healthcare, your physician or nurse practitioner or physician's assistant, sometimes they'll just give in and give it to the individual because they're busy and they want to sense, they think, hey, it won't hurt you. But the reality is it can hurt you, but it may not at that particular moment in time when you're taking the antibiotic, but it may be a delayed effect a month or two down the line, before you might actually manifest symptoms of this diarrheal infection of C. diff.
Well, I'll tell you, that was an interesting topic, and I'm sure our viewers and that person that wrote in now has a better understanding of it.
Well, yeah, if you think that's interesting, we ought to talk about when you have recurrent Clostridia difficile infection, and we start talking about replenishing the microbiome with a stool transplantation. That's another topic.
We'll do that on another show, okay?
Yeah, that's pretty exciting stuff.
Well, thank you for coming on,
thanks
Dr.
so much. Thanks, Jeff.
Thank you.
Are you in need of a gastroenterologist in the Naples, Marco Island, or Bonita Springs area? Dr. Raymond Phillips of Gastroenterology Group of Naples, along with his fellow physician associates, are board certified in gastroenterology hepatology and one of the most respected medical practices in Southwest Florida. Hear it from one of his patients directly.
I've been a patient of Dr. Phillips for myself personally the last 20-25 years. He's treated my family, my extended family, my friends. I never mind coming here because it's a very friendly place and everyone here makes me feel that way. They're so caring. And Dr. Phillips, I get a chuckle out of him because everywhere in his building it says, "We work where the sun don't shine."
With the medical industry changing so rapidly, Dr. Raymond Phillips offers the newest technology and treatments in his field. If you are looking for a practice that is attentive and will address all your questions and concerns, call Dr. Phillips' Naples office today for an appointment at 239-649-1186.